Welcome to the Life and Breath Foundation Speaker Series. This evening's topic that we're going to be talking about is exercise and sarcoidosis. Before we get started, wanted to talk to you a little bit more about the Life and Breath Foundation. My name is Sean Hall. I'm the president and founder of the Life and Breath Foundation. The foundation was established in 1998 in memory of my mother, Ida Hall, who had sarcoidosis. Not knowing what she had when she passed away in 1996, we created the foundation and really organized the foundation to have three primary goals. And that's to offer sarcoidosis community effective tools to track their journey, decipher medical issues, and maximize the quality of life of the patient, to provide a nurturing environment for those affected by sarcoidosis to share their experiences. We feel building a community and benefiting from those in the community that have experiences or challenges that can help us, doing it all together, knowing that you're not by yourself, are all key metrics of what the foundation is trying to build. And the last one is really to build more awareness within the medical community to help combat this chronic disease. This evening, we're going to be joined by Dr. Harish, who is a Life and Breath Scholar. He was a recipient in 2022. Dr. Harish is originally from Chicago, Illinois. He relocated to India as a teenager and completed his medical school at the Vadihi Institute of Medical Sciences. I didn't pronounce that right, but you'll help me out afterwards. While at Vadihi, he led a pulse polio drive immunizing over 500 children. After graduating from medical school, he joined the internal medicine residency program at Greater Baltimore Medical Center, which is located in Baltimore, Maryland, just outside of Washington, D.C., where he is currently in his third year. He is the recipient of the 2022 Life and Breath Scholar Award and has a keen interest in researching further therapeutic regimens for sarcoidosis. He is continuing on to pursue a pulmonary and critical care fellowship. In his time away from work, Dr. Harish enjoys hiking, playing soccer, and he is a diehard Arsenal fan from the Premier League. Vignesh, welcome to the Life and Breath Foundation Speaker Series. We're so happy to have you, and we're really looking forward to your topic this evening. Thank you for taking the time.
Thank you, Sean. Thanks for having me. Just give me a second. Just going to share my screen real quick.
What's the name of that institute? Because I didn't pronounce it accurately.
It's Vaidehi Institute of Medical Sciences.
Oh, I didn't do that bad. Okay, fantastic.
All right. Well, just thanks for having me. It's really a pleasure to be here. Really an honor to be part of the Life and Breath Foundation. It's such a great platform for us clinicians to really reach out to, like how you were saying, to the patients and really hopefully answer all their questions and provide them with the tools for success. All right, so just before I go and deep dive into sarcoidosis and exercise, just want to give you a brief introduction. We know sarcoidosis is a multi-systemic inflammatory disorder with a great variety of symptoms. It can be fatigue, shortness of breath, pain, reduced exercise tolerance, and muscle strength. Now coming to sarcoidosis and exercise. One of the main symptoms of sarcoidosis is fatigue. Patients are still encouraged to really participate in light to moderate exercise whenever possible. And the reason I say this is because, staying active really helps increase bone and muscle strength. It really helps you maintain mobility and keeps your body working efficiently. It also noted to increase your mood. Oftentimes many patients with sarcoidosis have generalized anxiety disorders, major depressive disorders. So exercise in conjunction with therapy and medications can really help boost your mood. It's obviously sometimes extremely frustrating to feel physically limited, especially for those who are exercising regularly before their diagnosis. And it can also be frustrating to, be told to stay active when you have such chronic pain and fatigue, and, not to mention the pulmonary, cardiac, or neurological involvement. However, there is a growing body of evidence. Research from the Netherlands recently found that following a regular training regimen, even a moderate level of activity, can help reduce certain symptoms and improve overall quality of life for sarcoidosis patients. In terms of literature review, I'm just going to talk very briefly about the studies that they've done in terms of exercise and sarcoidosis. Of the studies available, two are observational studies, non-randomized studies, and there's one that is a randomized controlled trial, which really just evaluated physical training in sarcoidosis. And what they did find is that there were significant and clinically relevant benefits. And this paper that I have up here, Strucape and others, which is an expert review, studied patients with sarcoidosis and really assigned them into two different groups, one which had a regimented exercise group and the other that didn't. And what did the study find, right? It found that there was a significantly greater decrease of fatigue in physical training groups compared to the patients who did not complete with a physical training program. The findings from the study was consistent with significant tandem improvement in sarcoidosis-associated fatigue, physiological health, and physical functioning after a period of physical training. This is another study by Caradali and others, which demonstrated that inspiratory muscle training, and what this is it's a breathing exercise that uses a pressure threshold device to really strengthen the muscles involved in breathing. And what did this study find? It found that there was an improved functional capacity, maximal exercise capacity, and respiratory muscle strength, all while reducing, the severe fatigue and shortness of breath, especially in the early stages of sarcoidosis. And it was noted that this could be safely implemented into pulmonary rehabilitation programs. And in this study, the last one I'll be talking about is by Hupman and others. It really described that an inpatient pulmonary rehab program had a positive impact on the functional status and quality of life of patients with interstitial lung disease, including sarcoidosis patients. And I mentioned pulmonary rehabilitation a lot, so let's talk about that for a second. What is pulmonary rehabilitation? Everyone's pretty aware of physical therapy. What about pulmonary rehabilitation? This is a program of education and exercise to increase awareness about your lungs and your disease. At these pulmonary rehab programs, you learn to achieve exercise with less shortness of breath. These classes are often, they're in a group setting, so you get the chance to meet others with similar conditions, and it gives you an opportunity to receive support from one another. You get stronger day by day with increasing your level of fitness, and exercising your lungs and your muscles can, help you just be more active and do things that you enjoy with your loved ones. And what consists of a pulmonary rehab program? Well, you have a doctor, you have nurses, you have physical therapists, respiratory therapists, exercise specialists, and dietitians. Together, these health professionals really create a program to meet your specific needs. And pulmonary rehabilitation is more than just exercise. It's an education and support for people living with this lung disease. After you've been at a rehab for some time, you can always take these exercises back home and continue doing so. But I would always check with your doctor before starting an exercise routine at home. And diet. I think talking briefly about diet is important. I think they go in conjunction with exercise. A healthy diet is just as important as exercise, I would say. And by no means do I recommend a specific diet. However, I think patients should aim to eat a balanced diet, and what that consists of really, plenty of fruits, vegetables, whole grains, lean, healthy fats, if possible, foods that are rich in antioxidants. These are also found to have, anti-inflammatory properties, which could help reduce some of the symptoms. A lot of patients with sarcoidosis, more than 90% have the lung involvement. So it's important to eat foods that will not cause more complications. And what do I mean by this, right? One of the major concerns of patients with compromised lungs are, shortness of breath while eating and a dry mouth. So how do you address this? To address the feeling of breathlessness while eating, I would try eating softer, moist foods that are easy to swallow and chew. You can also try liquids that have a lot more nutrients, like smoothies or juices or soups. And if you find that you have a hard time breathing after a large meal, I would encourage you to try eating smaller meals and try incorporate smaller snacks throughout the day. And more importantly, just take your time to eat. Rushing through meals can really limit your air intake and make you feel out of breath quicker. I was talking about a dry mouth earlier. That's something that many of us, especially sarcoidosis patients, feel oftentimes due to various reasons, be it medications or the inhaler medications that they're on. So if your mouth is dry while eating, there could be, like I was talking about, a few different causes. It could be breathing through your mouth, taking inhaled medications, or just using oxygen. And the easiest way I would say to address this is to make sure you're drinking the recommended 6 to 8 cups of fluids every day. Moving forward, medications and weight changes, right? I think everyone who has sarcoidosis has been on steroids at some point throughout their course. And as great as a medication it is to help alleviate a lot of our patients who have symptoms of sarcoidosis and help prevent the progression of the same, it also has a lot of side effects. And what are the side effects of prednisone, right? You can have anything from increased appetite, nausea, bloating, and weight gain, right? And these are all symptoms that a lot of the sarcoid warriors, I like to call them, have experienced while on prednisone. And what is prednisone? We'll just talk about that really briefly, right? Prednisone is a corticosteroid. It helps suppress inflammation, which really helps, leads to an improved symptom control and sometimes possible prevention of permanent organ damage. And, despite all the side effects that this medication has, it still remains the first-line treatment for sarcoidosis. And for many patients, one of the side effects that causes the most discomfort, I would say, is weight gain. And why does this weight gain happen with prednisone, right? Weight gain from prednisone is caused by water retention, right? And increased appetite. So some people experience body fat redistribution also. What does that mean? It's a symptom that is characterized by fat deposits collecting in unusual areas like the base of the neck or the back, right? And trying to figure out how to deal with rapid weight gain can sometimes seem overwhelming at times. But there are a few things that you can do to limit weight gain from prednisone and slowly reverse the process. So gaining weight from prednisone is commonly, like I was saying, due to fluid retention. One way to limit this is to limit the amount of is to eat a low sodium diet, right? Sodium, what does it do? It binds to water inside the body and helps maintain the balance of fluids inside and outside of the cells. So when you have a diet that is high in sodium, you're using the extra salt to also hold on to extra water, which causes fluid retention, right? So while you're making your diet more prednisone friendly, you can slowly start incorporating some exercises into your daily activities. To begin with, you can pick an easy activity that doesn't put too much pressure or stress on your body. I would include some cardiovascular exercises in your routine. That can be swimming, taking a walk, joining a class at your local gym, or just making up your own personal routine at home. It definitely can be intimidating at first, but I would just say, don't give up. And also with prednisone, what else can it do? As we age, it's widely known that bone and lean mass tend to decrease with age, especially in menopausal women due to hormonal changes. And steroids tend to accelerate the loss of bone mass. However, we do know from data that the opposite effect is seen with exercise, so which is in fact recommended for the prevention of osteoporosis. That's why it's really important. The whole point of this talk is trying to incorporate exercise into our daily activities. And the types of exercises, I would note that I'm not a yoga or exercise expert. However, having spoken to many patients with sarcoidosis and my fellow clinicians, they have stated that some yoga poses have helped improve symptoms. I was able to use these images from the foundation, which they had posted recently on their social media page. And these types of poses are the fish pose, which helps to facilitate full expansion of the lungs. Next is pranayama, which is a breathing exercise. It helps expand breathing capacity. And the other is trunk building poses. Last but not least, meditation. I think meditation is always helpful. Mindfulness-based exercises is an effective therapy, especially for patients with, anxiety disorders and chronic fatigue. I think mindfulness-based exercise aims to really reduce the stress and tension. Also note that, other exercises such as be it walking, swimming, low to moderate intensity exercises are beneficial too. At the end of the day, I think sticking to a regimen and understanding your body's demands will be helpful. And, I hope this was informative, and I hope that I was able to answer some of the questions that you might have had on exercise and sarcoidosis. As always, before you start any exercise regimen, please do let your provider know. And, once again, I'm just honored to be here and be part of the organization. And I'm happy to answer any further questions from the audience.
That was wonderful. I appreciate the guidance and the information. We do have some questions that were sent in that I'd like to ask you if you have a moment. First question is, how long do you think you need to work out to start to receive benefits?
So studies carried out so far involving patients with sarcoidosis have shown that physical activity can reduce their symptoms, and the positive effect of physical training in sarcoidosis is believed to be multifactorial. The physical training program in sarcoidosis really has to be individualized and should focus on the patient's needs and symptoms. Generally speaking, a high frequency, low impact exercise can be recommended. We need to do a lot more research in terms of the training program parameters. And what I mean by that, the duration of exercise, the frequency of exercise, and ways to achieve the optimal and long-lasting effects. But I think just maintaining consistency and intensity is key. Everyone's body at the end of the day is different. One might see the benefits sooner than compared to someone else. So I think the key is just being consistent here.
So just staying on that topic, when is something considered exercise? I mean, do you have to sweat, or is it just moving around?
You really don't have to break out in a sweat every time. I think getting regular daily exercise, be it yoga, swimming, running, walking, is all beneficial. I think the key again is just being consistent and listening to your body. I think you just have to have a dedicated exercise regimen, and with consistency, you can see how your body is adapting, and you can always increase your intensity as long as your body allows. And like I always say, always let your provider know before you start any kind of exercise regimen.
So let's say you're going to talk to your doctor about the exercise regimen. You're trying to determine, as you mentioned, the frequency, especially when you're starting out and building up. In your estimation, would you recommend 2 long sessions per week or 15 minutes every day?
I think that's a great question. And the answer is that there is no real magic number. I always tell my patients that whenever they start a new program, always start with something slow. You can just try maybe walking, because everyone's body is different. So you can try walking 3 times a week, maybe 15 minutes a day. And if you're doing well, and if you feel like you can do more, then I would increase it to maybe 4 times a week, 20 minutes a day. And with these slow increments, if need be, if your body tolerates it, go up to, 5 times a week and 25 minutes a day. So there's no real magic number.
Okay, and we have on that note that you just gave, we have a specific question with somebody in our audience, and basically the person works out 2 to 3 times a week. They do 25 minutes of cardio on the treadmill, brisk walking, and then weight training for an hour. Is that okay?
No, absolutely. That's honestly more than what I'm doing right now. So if you're able to, I would say continue to do so. At the end of the day, you are the best judge. If your body is able to do so, I would continue. But like I say, just proceed with caution and always consult your provider if needed.
Gotcha. So we have another person on the other side of that comment. Is the question is how can I keep up when I'm so tired? And that's exercise.
I know. I mean, it's definitely difficult and always easier said than done. The pain, fatigue, and shortness of breath that sarcoidosis patients face, there's so many barriers to many popular workouts. However, many workout routines can be adjusted to suit specific needs, giving people with special requirements the opportunity to live an active lifestyle. For example, there are several yoga poses that we were talking about earlier that have really helped patients with sarcoidosis for various different reasons. And I think making these adjustments can lead to a healthier, happy life. And, I would also say, take exercise tips from other sarcoidosis patients if possible. This is what the foundation is all about. It's getting everyone to connect with one another and getting support from one another. A lot of sarcoidosis patients, since they know what it's like to battle chronic pain and fatigue, I think talking with other patients might be helpful to gain some more tips on how to proceed.
Awesome. I think you just hit one of the questions, and that was, someone that is extremely fatigued and, possibly what could they do, for exercise. I think, trying maybe a little bit of that yoga and the poses, it would maybe be a great start for that person. Anything else would you recommend for that person that, reasonably, and I would think that the frequency would have to be adjusted also, right? It's just start out slow and try to listen to your body and, speak with your physician.
Right, exactly. I mean, you can also just try walking if that's something possible, as long as the body tolerates it. Swimming is another exercise you can do. And then if your body's getting adjusted to that, you can always go to light to moderate intensity exercises, all of which are beneficial. And, honestly, if you don't really know where to start, you can always think about pulmonary rehabilitation or even physical therapy and ask your provider for a referral for the same.
Okay, good suggestions. Our next guest has a question for you. So they feel if they don't do cardio for a week, it feels harder to breathe. But once they start running, they feel better. So the question is does fibrosis get better with activity?
So, fibrosis does not get better activity, if that's the question, but I think the whole point of exercise in itself helps to improve your symptoms overall. You have an increase in exercise tolerance, the shortness of breath tends to get better, your quality of life overall from all the studies that have shown does help. And yeah.
So we have a question about remission. One of our patients is in remission, excuse me, and wants to know, will it come back? What happens to all the scar tissue in your lungs?
No, we've seen this a lot of time with patients with sarcoidosis. Oftentimes they get better, self-resolves, and sometimes they have recurrences, and this can happen. And when that does happen, it's very important to follow up with your pulmonologist, get the various testing that needs to be done. You might need to be restarted on the medications that you were initially on. I think it's a multidisciplinary approach between you, your provider, and your primary care doctor to really assess how you need to move forward if your symptoms flare up.
Okay. Awesome. Our next question centers around someone that recently got diagnosed, and before being diagnosed, they were very active. And their question is can you increase your flexibility endurance after diagnosis?
I think it can be extremely frustrating, to feel physically limited, especially for those who were exercising regularly before their diagnoses. And I think it can also be frustrating to be told to, stay active when you have chronic pain, shortness of breath, and all the other manifestations that sarcoidosis has. However, all this growing body of evidence really just shows that a regular regimented training program, even if it's, very moderate level activity, may help reduce certain symptoms and improve the overall quality of life. It can also help improve your flexibility and endurance for sarcoidosis patients.
Well, very good. Thank you for that. You mentioned earlier just a couple different things different patients can do relative to their circumstance and their situation, in concert with their doctor. Is there, in your opinion, is there a best exercise for sarcoidosis?
I don't think there's really a best exercise per se, like we were talking about earlier. You, at the end of the day, know your body better than anyone else does. If you don't know where to start, I would say, ask your doctor if you can start with physical therapy or pulmonary rehab, or even just these yoga poses that we were talking about earlier, the various different fish poses, the cobra pose, or like I was talking earlier, walking. And if you're able to tolerate it, then you can always advance as your body deems fit, from light to moderate intensity. And all of the data that we have really just suggests that exercise in general is beneficial.
Gotcha. Now the next question is centered around exercise and oxygen levels. One of our patients sometimes feel depleted due to exercise, and the question is how can they recover oxygen more rapidly during exercise?
So I think I need to better understand this question, when they mean by oxygen status. Are they using oxygen while exercising or not? But obviously, if you are, you should definitely speak to your provider before doing any kind of exercise regimen while you're on oxygen. I don't think there's any quick way to really recover the oxygenation. But with these exercises that we do, they have shown that there is a increase in your inspiratory effort. So doing various breathing techniques will really help with bringing up your oxygenation.
Okay, good. What do you do for exercise if your arms and legs are experiencing stiffness?
Right. So I think that's another great question. I would say first, I would continue exercising, because if you just stop, then you're going to feel a lot more stiff than you did the day before. So, yoga, walking, swimming, and really stretching. Stretching really helps with ease with the stiffness. You don't want to do anything that really overworks your body. And, I would also stress that if you're experiencing severe stiffness, to please contact your provider.
Okay, well done. So you mentioned earlier prednisone and the ability for prednisone to cause weight gain. Are there any good exercise to lose weight while you're on prednisone?
The weight gain from prednisone, like I was saying, it's caused from water retention and an increased appetite. So what I would say would be, start off with a low sodium diet. And once you've done this and you have a prednisone-friendly diet, you can, pick up an activity that doesn't put too much stress on your body, like start walking 15 minutes a day, 3 times a week, and you can just increase the frequency and intensity as your body tolerates it. There's no specific exercise to really combat the effects of prednisone. At the end of the day, just getting the exercise that you need will definitely be beneficial.
Okay. Um, how do you exercise when you're in pain or in a flare from sarcoidosis or fibromyalgia?
And that's another great question. I think it's very difficult because one of the symptoms from sarcoidosis are pain and fatigue, which just make it difficult to maintain an active lifestyle. And working out can almost feel impossible on bad days. However, just keep in mind that light, easy exercises can improve your health and will enhance your overall quality of life. A lot of the sarcoidosis patients that I know have found that just walking, yoga, swimming have really just greatly improved their overall health. And if you don't know where to start, you can always, speak to another patient who has similar symptoms as you and see how they got into the exercise regimen, because they might have certain tips that will be beneficial to you.
Okay, awesome. Is there anything that you could think of in this situation? So we have a patient that exercises and then stops for just one day, and then the very next day they feel pain in the joints, especially the ankles. Do you know what that might be due towards?
It could be of various multiple things. It could be a delayed onset muscle soreness from exercising the prior day. So I think that's why stretching is very important. You can try foam rolling. That's something that I've used a lot and really helps alleviate all the joint pains and the stiffness that one might experience after doing an exercise the day before.
And you know what, that just thinking it through, that might be a really good place to start for a lot of the people that are on this call, is to get that foam roller and to start rolling their muscles out in different areas. And sometimes you can work up a sweat, sometimes you can work up a little bit of a lather, and may not be exercise, but it's movement that could cause you to feel better. And you could, as you mentioned, just talking about stretching, I don't think we can stretch enough, all of us. We can't stretch enough. Any thoughts there?
Yeah, absolutely. I think you hit it right. I think you're really astute in making that observation, because stretching, none of us can ever get enough of it. Really, just starting off with some basic stretches and even foam rolling will really be helpful.
So I appreciate you taking time to answer the questions. I came at you a little bit of a rapid fire, but you really did a nice job at answering the questions and everything. What I wanted to do is to challenge everybody that is listening live or those that are going to listen on the playback. And I'd like them to kind of think through some goals and objectives of how they could possibly join us for the Take a Breath for Sarcoidosis 5K run, race, 1K walk. It's something that we do as a foundation in every April, National Sarcoidosis month. And what that event is really about is giving the patients something to look forward to, something that they could do on their own, have their family come out with them, have their caregivers come out with them, and they can look at one day over a 2-week period, to walk, to run, to build up. And this may be just something they could put on their, agenda that, hey, goal-wise, this is what I'm going to do. I'm going to be part of the Life and Breath Take a Breath for Sarcoidosis. It's a virtual event. You can do that from where you are, in your home, in your treadmill, in your gym, in your community, in your park. And it's something that you could do to make you feel better, to take control of your own health and be an advocate for your health. just one way that I could think of that we could kind of join together and kind of bring this exercise back into, the fold with the patients. Any thoughts on any of that?
Yeah, absolutely. I would encourage everyone who's on this panel and tell their friends and everyone else who can get on, the 5K. I'll try my best to be there as well and in support of everyone. And while I'm there, happy to answer any questions that come our way.
Yeah, the last 2 years we've done it virtually. I hope in 2023 we can get back to it being in person. We've had a great opportunity. We've had over 35 states, different people in different states in the United States join us when it was a virtual race. So it's really has gotten out there and embraced people and pushed people to exercise, to feel better, to eat right, to do something that is going to make them feel better as they combat. And then, as you mentioned, to communicate with their physician. Am I doing this okay? Get a pulse and a read on how things are going. Start small and build slowly. That's fantastic. Is there any thoughts, Doctor, in closing that you could share with us that may help, in a summary fashion with those that have sarcoidosis? They're going to consider how exercise could play a part in their lives, in their regimen, in their efforts to feel better as they are managing the disease at various stages.
Right, absolutely. Sarcoidosis is definitely difficult with all the symptoms that the patients have, the shortness of breath, the pain, the fatigue. However, like I was saying, there's just so much evidence now that just incorporating whatever your body can tolerate it, like you're saying, Sean, to start small, get in touch with your provider. And, I think the most amazing thing about this foundation is that we have a platform for everyone to get together. It's a resource for other patients for them as well. So reach out to other patients and see, ask them, what has worked better for you? I have pain and shortness of breath. I've been trying to do this exercise or that. One or the other has been working, one hasn't been working. So I think, just getting together will be really beneficial.
So
And
a lot of this information can be found on our website, www.lifeandbreath.org. We also have a YouTube channel that we're going to be sharing the replay. We have a Facebook page. Again, our mission is to make the connection for these patients, to build that community and make sure that you understand that you're not by yourself, that we're there to help. We're there for you to reach out to if you have a question. Any question that you have pertaining to any of the information shared tonight, please feel free to drop it in the chat or email us at info@lifeandbreath.org, and we'll make sure that we'll get back to you with an answer, question, or a concern. But on behalf of the Life and Breath Foundation and the many patients who we strive to serve and to partner with, Dr. Vignesh, we really appreciate it. Congratulations again on being selected as the Life and Breath Scholar, and we appreciate what you do for all patients and all of the caregivers. Your work, your tireless work is greatly appreciated, and thank you for coming on and sharing a little bit more of the information this evening.
absolutely, thanks for having me. It's a pleasure to be here.
You're quite welcome.